this video will be discussing eating disorders in females.
Am I pretty enough to be noticed? Will they love me if I go on a diet?
Why do girls need to be skinny?
Do you think I'm fat?
Do you think I'm fat? Do you think I'm fat?
It's important to understand what an eating disorder is.
What is an eating disorder? Eating disorders occur when some uses food and weight as a way of coping with feelings of anger, trauma, and despair. A person thus tries to find control. This may mean controlling their body weight by eating too much, or by hardly eating anything at all.
It's important to know that eating disorders are serious mental health issues. And thus should be taken as serious as a physical health issue. It is increasing amongst our population and anyone can be affected.
First, we would like to talk about anorexia nervosa. An anorexic is someone who refuses to maintain their body weight. They show extreme fear of gaining weight and have a distorted self-image. There's often a loss of period for girls and women.
Next, we would like to talk about bulimia nervosa. A bulimic is someone who carries out binge eating, which is eating a lot in one go, and they have no control whatsoever. And often they will carry out inappropriate behaviors, such as vomiting, to prevent weight gain. They also focus highly on their self-image and weight, which drives their negative behavior.
I can't think well. I can't concentrate. I can't memorize. I became tired at 8 o'clock in the evening. I wanted to go to bed. I was so physically, emotionally, mentally exhausted. Well, that just means I have a very, very slow heart. It's starving. My muscles hurt to walk. My muscles hurt to go up the stairs. My muscles hurt when I was sleeping. It hurt to sit down in a chair because my tailbone and my everything was, all my bones were in contact with the seat. There was no cushioning.
This is just another form of suicide.
Valeria Levitin has suffered from anorexia for more than 25 years. She weighs just 4 stone.
Let's talk about the causes of eating disorders.
So what causes eating disorders? Growing social pressures. Women between the age of 15 to 25 are most likely to be affected by these eating disorders. Transitions and stress. Any sudden or unmanageable change in a person's life can result in emotional stress, which in turn increases one's risk of having an eating disorder. The media always models the belief that skinny equates to success and popularity. You can easily surf the web for pro-Anna or pro-Mia tips and how-tos.
How can we treat eating disorders?
If they weigh 70% or less of that, then they are required to be tubed.
Restoration of optimum body weight through the use of proper eating programs obtained from dietitians and effective behavioral strategies obtained from psychologists.
Psychotherapy includes individual therapy, helping patients to deal with thoughts and behaviors that trigger poor health behaviors. This is done through increasing self-esteem and positive coping strategies for certain situations that can cause distress. The most effective method used is called cognitive behavioral therapy, and it is necessary for these interventions to be carried out and maintained for periods up to 1 to 2 years, especially to those suffering from very high and extremely dangerous levels. This includes self-observation, stimulus control, self-talk, relaxation methods to help them cope better with their surroundings and to improve their chances of recovery. The family plays an important role in ensuring the required health behaviors are followed. This includes eating healthy meals as well as healthy quantities. Group-based therapy. This type of therapy is good for the sufferer as they are exposed to people with similar conditions as theirs and thus can support and share their experiences.
How can someone cope with an eating disorder? Understand that friends and family want to help you, not judge you, so it's important to surround yourself with social support. Don't compare yourself to others, as all body types are different. Avoid websites that promote anorexia, also known as pro-anorexia websites. Be aware of situations that trigger poor eating behaviors, such as skipping meals, and find effective ways to alter them, such as thought stopping, self-talk, cognitive restructuring. Surround yourself with positive role models. Be aware that all photos in magazines are altered through modern technology, so the models and actors are not nearly as thin as they seem to be.
Can an eating disorder be prevented?
Yes, it can.
What to look for?
You should look for a family member or a friend who shows signs such as poor self-esteem, severe dieting habits, an excessive exercise plan, a poor self-image, and not to mention overeating.
What to do?
It's important to talk to the person and seek professional help. It's important not to be judgmental and to be understanding.
But what if I have an eating disorder?
If you believe you are vulnerable to an eating disorder, it would be best to speak to your friends and family. You should express your need for their help and support. You can also ask them to help you develop healthy behaviors. If that doesn't work, you can ask them to help you seek treatment.
They're not shining. Her hair falls perfectly without her trying. She's so beautiful, and I tell her every